Well, I had always been interested in minimally invasive surgery, and the next step in that was navigational surgery. So when I was at the Academy of Orthopedic Surgeons in Chicago, that's where I first got to see the Mako robotic system. And I brought that information and that technology home and presented it to the administration and the board members here at the hospital. And they were very receptive to that idea and wanted to be on the forefront of orthopedics in our community. We got that technology in 2015, and that's when we started doing robotic hip replacements and partial knee replacements. And then in April of 2017, we actually became only the second hospital in the state of Tennessee to be able to do robotic total knee replacements. And since that time, it has just blossomed tremendously to the number of robotic cases done at our hospital. Well, orthopedics lately has been progressing toward smaller incisions, quicker recovery time. There was a period there where we went to minimally invasive surgery, and then we went to navigational surgery using computers to assist us with surgery. And now the next step in that is the robotic surgery, which has just allowed us to be much more precise and have smaller incisions, have more predictable outcomes where we know the patient's size and we know their flexion numbers, their extension numbers, and we can balance their alignment problems, and we can get them recovered quicker with robotic surgery because there's less downtime with it and quicker recovery. Everybody's excited about that. Well, as the pioneer in getting the robot here to the hospital in 2015 and watching how it's grown and how our robotic program has led the way in Northwest Tennessee, it's really been amazing because at first, it was only hips, and then now it's become knees, and other surgeons have bought into the robot. They see the advantages of the robot, and our numbers have continued to grow tremendously to where we're leading the way now to become a regional referral center for robotic total knees and hips in Northwest Tennessee, and it's really a great thing. Yeah, I think it's probably like anything else with orthopedic surgery. The more you do, the more comfortable you become, and the better you are at that procedure. And robotically, when we first got that in 2015, I did 6 hips and 4 knees that year. And then in 2016, that went to 56 hips and 10 knees. And then in 2017, when we added the total knee ability to our protocol, that's gone to 41 hips and 102 knees. So now when you look at the number of robotic cases that I've done total, when you're doing over 100 robotic total knees a year, I think it makes it where you're able to handle those unforeseen things that happen and more predictably and more reliably achieve a more accurate outcome.